Hello, everyone. It's May the 20th, Wednesday. I've got a couple more deaths to report. I hate this like crazy, when I so look forward to the time when we can hope and pray that we don't have deaths to report and we've got calm seas and maybe some clear sailing, but I keep telling everyone we've still got rough seas in front of us, and we're going to try to navigate as best we possibly can through those, but we're never going to be able to navigate through those without the cooperation and help of all the great West Virginians that are out there, so please don't forget to do that. But we lost, as our 68th death, we lost an 86-year-old female in Kanawha County. Both these people that we lost were from Kanawha County. We lost the 69th death, a 75-year-old male from Kanawha County. Please remember these people in your thoughts and your prayers, as Kathy and I will, and always just take time. Let's always do this, that we don't drift to where this is just another statistic in our life and we just move forward. We've got to remember these are moms and their dads and their brothers and sisters, and they're absolute, in most instances, not children, but they're absolute great West Virginians, and we miss them, and let's just all pray for their families and all their loved ones. In moving forward, there's no point in me rehashing your executive order, that is in week 4, and I think, Jordan, if you want to put that up. Businesses are, there are guidelines there from our state park campgrounds to, for residents only, to all kinds of things, from whitewater rafting to indoor dining, with, observing all the guidelines and everything. And so you can see all that, and all that is up and going as of tomorrow. In week 5, the guidances and everything, and I think Jordan has that, will all start on Tuesday, May the 26th, the day after Memorial Day. And these businesses are on the screen, from the standpoint of the bars. Indoor bars will be open at that time at 50% capacity. Our museums, our visitor centers, our zoos, and our state park cabins and lodges will be open at that, then to only in-state residents again. Now, one thing that we're doing is, as we move forward, and this was originally driven from the standpoint of an idea that something that we ought to do as a special thing for our first responders and our state police and, all of our healthcare community, all the people that were on the front lines, maybe our grocery workers, and which have been absolutely on the front lines, whether it be people at pharmacies or wherever, and we thought, well, that's the way to go. And then I basically said, no, that's really not the way to go here. And what I'm referring to is the idea was placed on my desk as, why don't we do something that would give an additional discount, or a discount rather, to those people that really were the true frontline soldiers, and let them be able to go to our state parks all over West Virginia at a discount, and through the course of the summer, and so then, I started thinking about it, and I said, well, we're going to end up leaving somebody out, just sure as the world. Sure as the world, we're going to leave out frontline soldiers that have done great, great work. So I said, why not just do all? And why not do something really special for all West Virginians? And that's what we're going to do. We're going to do a 30% discount to all West Virginians from June 1st to August 31st. And we're calling it West Virginia Strong Discount and everything. And that's for all our state parks and activities there. And so go West Virginia and enjoy the parks that you have that are dear to all of our heart and everything. You'll help from the standpoint of, helping West Virginia, but in every way. But this will not be for out-of-state people, but it will be for in-state. And we want to encourage all West Virginians to enjoy our beautiful state that we have in so many different areas and everything that if you haven't been, go. On an update on, our jail systems and from the standpoint of positives that we have in the jails, I think we've got Betsy Jividen with us today, and she's going to provide more information. I can tell you that the testing began this morning by the National Guard. All staff working this morning shift, and all inmates in the affected dorm were tested this morning. And I want to thank the Division of Corrections, the DHHR, the National Guard, and anyone for quickly responding to this situation. I think we've got a couple more positives, and Betsy Jividen will get into that in just a few minutes. Is that correct? Okay. I want to remind everyone again, about our website. It's up for the cities and the counties. Please, as I continue to remind you and everything, apply now. The restrictions are pretty tough. Abide by the restrictions and everything now, but know, as the restrictions are eased off, you will have multiple bites at the apple here. This is not a one bite time. You don't have to put everything in the world in it and everything of hope in it and everything. As the regulations and the guidelines change, you will have additional times to reapply and reapply. So, but try to get out now and apply, and we'll get those monies heading your way very, very, very quickly. From the standpoint of the testing of our most vulnerable West Virginians and our minorities, we are now, as of 9 o'clock, let me make sure that I get this right. As of 9 o'clock on May the 22nd, and the 23rd, from 9 to 4 p.m., we will be testing in Marion, Monongahela, Kanawha, and Cabell counties. All your testing is free. If you want to get tested and everything, come by and everything. If your anxiety level's up, not feeling the greatest, think that, from the standpoint of minorities, whatever the situation may be, think from the standpoint of your age or whatever it may be, come and get tested. The more we're tested, the better off we'll be, and we'll be in those counties from 9 a.m. to 4 p.m. on the 22nd and 23rd of May, and that'll be in Marion, Monongahela, Kanawha, and Cabell counties. I think the only other thing that I have on my list, other than our charts, and to update you on that, is just a reminder again about the census. I can't beat that enough. I mean, unless we just want to throw away money, go get counted. There's a fear, a stigmatism, that there's people out there that believe if I get counted, they're going to take something away from me. I can't fathom that. Really and truly, at the end of the day, we've got to all be counted. We can't live in the ages of old and everything. We have got to live in the ages of new. And this hurts us by not being counted, so please get counted. I can tell you that from our charts that we're watching and watching ever so closely is just this, is yesterday as the daily rate of the positive growth rate, you'll see that little blip up. It wasn't bad, but it was up at 2.4%. Remember, we want to stay below 3, and that jumped up in one day to 2.4. Now, however, as we continue, if we'll look at our cumulative percentage of positive tests, we continue to trend down. Today, we're now at 1.92%. Yesterday, I think we were at 9.3. As we continue to move, it is amazing beyond belief. How you have done, West Virginia. I keep saying it over and over, but you are less than 2%. Kentucky, that's the closest state to you, they're at 5.5. Maryland is at 20. Ohio's at 10.5 now. Pennsylvania at 18, and Virginia at 16. So you've done an amazing job. We just got to keep it up. We're going to watch the numbers and continue to watch in every way. As far as your, the active cases and the recovered cases, we're still continuing to separate in a positive way. That's all good. The wider that is, the better it is, and so because you can see your recovered line is on the top, bottom line's on the bottom, or active line's on the bottom. We've got 505 cases that we're working actively right now, and 977 on the top that have recovered, and that's all good news. The only thing I would add is just this, and I think that our health people will get into this more in just a few minutes, but we're still really, really dialed in and watching our panhandle counties. We're watching all of our counties, but especially those, right, because they're sitting so close to the Virginia neighbors as well as the DC neighbor, and we have got to be super, super careful there. Of all places, that is a place we're really dialed into and watching like crazy, and we urge the people there as they go out. That's good, all's good, and all that's working, but just please use your head. You regulate your exposure on this disease. You make the final decision as to whether or not you will be affected, and then have the ability to affect others. So absolutely manage yourself. Manage just yourself and everything. But these counties we're concerned about, and I think our health people will get into a little more detail about that. But besides that, I think West Virginia, you're doing good. We'll watch our hot spots, and we'll watch our jail situation, and we'll run to the fire as we're trying to live with this terrible disease now, and we're just going to have to some way manage it, and know the seas will be rough until we get a drug that pushes us across the finish line and enables us to go back to normal. But anyway, that's all I've got, and thank you so much.
All right, thank you, Governor. Let's first go to Brian Abraham, the Governor's General Counsel.
We wanted to take the opportunity to address some issues regarding confusion over the 25 public gathering. As we built these guidelines, we received multiple calls. People had questions whether this applied to them or not. But more importantly, as we've started to offer relief from these guidelines, many businesses have called in to ask how the 25 public gathering guidelines might apply to them. We realize there's many out there that may be confused, and so, quite frankly, sometimes we confuse ourselves. But the thing we need to keep in mind is the 25 public gathering does not apply to our essential businesses. For instance, as we left many of our manufacturing businesses open, we made very clear the 25 guideline did not apply to them, and they, in fact, kept their employees in place as they needed. We've gotten various calls from, as I said, these industries that are opening up, restaurants. We put out specific guidelines for restaurants that was the 50% for indoor dining. So obviously a restaurant that had a capacity of 100 would not be limited to 25, but rather to 50. We've had wedding chapels have been calling rather regularly now, asking about the 25 limit. The same thing with churches. When we put out the guidelines for the churches, although we'd never closed them, we had many ask about the 25. So what we've suggested is any of those essential businesses that we've offered guidelines for, then that's the guidelines that should be followed, and not worry about this 25. Interestingly, I had a call today from one of our delegates that indicated her husband was having a retirement party this evening at a restaurant, and that they had limited the party to 25 people. And when I asked her why, she said, well, we think that's the limit. So that's why we felt like there's enough confusion out there. We wanted to clear it up, that there is no 25 public gathering limit on our essential businesses. The best example I could offer of a public gathering would be something just an ad hoc picnic, where a group of people just gather in a park or something. Those are the things we're trying to discourage that don't have any particular purpose other than just the socializing itself. Here, where a business is essential, they will have a guideline to follow, and we will ask they continue to do so. But we were getting enough calls from these various businesses as we began to open. We wanted to make sure we were able to clarify that. The governor's office is always happy to take any questions or concerns that members have, and we ask you to continue to reach out to us, and we'll try to answer those as best we can.
All right, thank you, Brian. Next, let's go to Betsy Jividen, the Commissioner of the West Virginia Division of Corrections and Rehabilitation.
You're on mute.
Hold on just a moment while we unmute.
Sorry, everybody. I need a kid in here to do this for me. Thank you. As the governor mentioned, we now have 2 inmates who have tested positive at Huttonsville, and as well, we have 2 staff members. Both inmates were have been isolated, quarantined on Monday due to low-grade fevers, and were caught through our process of medical screening that we've been using up to and continuing now in compliance with the CDC guidelines and in coordination and consultation with Bureau of Public Health and the local health department. Once those positives were discovered, and we also discovered 2 positive staff members, in further coordination with the Bureau of Public Health, we started the enhanced testing today at Huttonsville. Thank you very much to the National Guard who assisted with this and came on site this morning. We have, I think, over 200 employees that were tested today. The National Guard is returning tomorrow between shifts so that we can get the rest. Also, the 43 inmates who live on the unit with the 2 inmates who have tested positive have also been tested. All those test results are currently on their way to Charleston. We will wait and look at these test results and then get the expert guidance from Dr. Marsh and the Bureau of Public Health and from the state and local health authorities, and then proceed as they feel is best with respect to any more targeted or enhanced testing. And they, of course, are going to be doing the contact tracing, which will provide us the information we need to know for that facility.
All right, thank you, Commissioner. Next, we'll go to Scott Adkins, the Director of Workforce, West Virginia.
Hey, good afternoon. I wanted to take an opportunity to talk about unemployment, but particularly in just a few minutes, talk about the folks who've applied for pandemic unemployment assistance. First of all, I want you to know that Workforce has dispersed more than $600 million to West Virginia families that have been impacted by the coronavirus since March 16th. Workforce is currently dispersing all Unemployment Cares Act benefits, including PUA, PEUC, which is the extra 13 weeks, and also FPUC, which is the additional $600, in addition to regular state unemployment to more than 200,000 eligible individuals in West Virginia. I can tell you Workforce staff continues to work to process claims and to address various issues related to those claims. Workforce recently identified a system issue with the PUA claims for pay dates of May 12th and May 13th. For you folks who've applied for PUA, on your dashboard, it will indicate pay dates that you should have received payments or that payments were dispersed. Those folks who were scheduled to receive payments on May the 12th and May the 13th have unfortunately been in a delay pattern to receive those benefits. Fortunately, however, the matter has been resolved. The folks who signed up for a debit card through the PUA system, you'll be paid by that debit card by this Friday, May the 22nd. So you don't really need to do anything at all. Just do your weekly certifications. So if you have that debit card in your hand, make sure you activate it, go online, do your weekly certifications, and your back payment should be on your card by Friday, May the 22nd. There are about 200 eligible claimants who incorrectly entered their direct deposit information into the PUA system. You're going to receive your payment this week by check. And so If for some reason you think that you may have entered the wrong information about your bank in the PUA system, be sure you're on the lookout for that check. You should receive it by Friday as well. Debit card users can check the status of their unemployment benefits on their debit card by going to key, the number 2, benefits.com, key2benefits.com, and you can check the status of your benefits there. Individuals that signed up for direct deposit through the PUA system and were scheduled to be paid May the 12th or May the 13th and did not receive payment, you're also going to receive payment no later than Friday, May the 22nd. Some folks have received duplicate payments. Most of those payments have been recalled. However, there are some folks who still have an overpayment, and we'll address that issue later. Other folks in the PUA system, as part of the error, also received notice of duplicate payments, but were not paid at all. And so it created an overpayment on their dashboard and also prevent them from doing their weekly certifications. That's been removed. The banner indicating the overpayment and the overpayment itself has been removed from the PUA dashboard, and you now can complete your weekly certifications at pua.workforcewv.org, pua.workforcewv.org. In order to prevent the possibility of future delays, everyone that signed up for direct deposit, please enter the PUA system on your dashboard, verify and update if necessary your direct deposit information. Thank you.
All right, thank you, Scott. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon, and I want to reinforce what the governor said to begin with, which is that as we open back up again, we do understand that people coming into West Virginia do create a risk to our state. The most vulnerable area is certainly in the eastern panhandle part of the state, just given the national statistics which demonstrate that the Washington, D.C., Maryland area is one of the fastest growing areas on the rate of new cases for COVID-19. So as we open back up again, it's really important that people pay a lot of attention to protecting themselves. There's also a new study that is coming out, and it's gotten a lot of play, which is a study that looks at the impact of wearing masks. And there's a number of researchers that are very talented that came together from different countries, including the US, to do this study. And what they found is if we have 80% of our people wear masks, we will be able to reduce the threat of COVID-19 infection to a level that we should continue to be able to move forward with our openings and feel very safe about that. This study compared some of the results in Japan versus the US. Japan has a population that's about 38% of the US, but so far total, Japan has about 785 deaths from COVID-19. The US is well over 90,000 deaths. So the risk of having the spread of COVID-19 in Japan, which really hasn't shut down its economy, is about 2% of what it is in the US. And so this information really gives us another piece of evidence that suggests that if we can get people to wear masks or face coverings at an 80 to 90% level, then we should feel really, really good and comfortable that we will be able to move forward and keep going forward. As we dance, we can keep taking steps ahead. But if we don't do this, and if we don't socially, physically distance, then I am very worried, as I know others in the state and the governor, that we could have, outbreaks and clusters of positive cases and people dying, since West Virginia is such a vulnerable state. And we will have to take steps backwards, or stop, or even get off the dance floor and go back to a more stay-at-home kind of approach. So it really is in your hands, West Virginia. And as we understand this information, it's even more important for us to double down and get face coverings and wear them out in public, and particularly when you're inside together, because the virus does spread person to person. The last thing I want to say is that there are some new vaccine trials that are coming out from Boston, Massachusetts, from a company called Cambridge, or called Moderna, which is in Cambridge, Massachusetts. And they've injected people with a different kind of vaccine. And a few of those people have responded with a vigorous response of antibodies like they had the viral infection. And that is very, very enlightening and gives us optimism to think that as these multiple vaccine companies are moving forward, that we should see success in this venue, in this area. But to get that scaled up and to get that delivered is still probably months to a year and a half away for really being able to deliver that, even if we find one that is really superior. So we should be optimistic about the future and to be able to deal with COVID from a vaccine. And there's drugs, as Dr. Slump talked about yesterday. But the key is that it's really on each one of us to protect ourselves, to protect our communities, protect our healthcare workers, and to demonstrate the excellence in the community that's helped us so far. So thank you so much.
All right, thank you, Dr. Marsh. Secretary Bill Crouch and Dr. Kathy Slimp from the DHHR and Major General Hoyer with the West Virginia National Guard are also joining us today and are available for questions. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Kenny Bass with WCHS.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. Governor, a lot of questions because Memorial Day is quickly approaching. How about swimming pools? And you've mentioned bowling alleys, movie theaters are still in limbo, and the fairs and festivals crowd is also very anxious. Is there any way the state can give direction to these businesses, not necessarily opening, but what sort of time frame you're looking at for making a decision about when these businesses can open and move forward?
Kenny, I get it, I understand, and here's where we stand. I had really hoped that today we were going to be able to give guidance on at least, swimming pools and bowling alleys and movies, and the fairs and festivals are still, something. I had a great conversation with a beautiful young lady that I think's heading up the whole fairs and festivals thing, but she's the head of our West Virginia State Fair. I think, Kelly's maiden name was Kelly Tutwiler, and I like I said, I had the opportunity to coach her and watch her grow up, but she's doing a marvelous job and everything, but now she's Kelly Collins, I believe, but nevertheless, we're really trying to digest and buy some time, to tell you the truth. I would love for us to be able to have our festivals and all the 4-H stuff that goes on there with the kids is unbelievable, and our state fair and all of our fairs. I'd love for us to be able to do all that and everything, but we've got some more hard work in front of us to be able to see, just how things are going to go and everything before we can get there. As far as going back to the swimming pools and the the movies and the bowling alleys and that kind of stuff, I'll promise you that tomorrow we will have those guidelines and we'll have those dates. I'm really hopeful that it's not going to be too terribly far away. If we're following suit with neighboring states and everything, that it surely looks like that we can pull this off, right at the 1st of June, and so we'll have more dates certain on those then, and I'm very, very hopeful that in the next couple of weeks we'll be able to have dates certain on some fairs and festivals, or more of a guidance as to where we're going to hope we're going to land. I am well aware with our fairs and our festivals that they have things that they have to book, whether it be rides or concerts or acts or whatever it may be, and they have, if they're not booked by a certain period, then not only do they stand a chance of losing that, but if they do book, then they stand a chance of losing all their deposit and all their monies if by chance, things work out to where we can't have it. So I know the dilemma, our people are really working it. And I also know this, why can't we, if we can go into a big box retail store, why can't we, socially distance and abide by it in some way, have bowling? I get that, and the same way with our pools and stuff. There's all kinds of what if and what if and what if, and we're trying to work through all the wickets and everything. And I think we'll have more guidelines and everything on pools, bowling alleys, and our movies and everything and movie theaters from the standpoint of tomorrow. We'll have that. We just didn't get it done because there's just so many other moving parts that we're trying to work on, and we just didn't get that done today, and we'll get it done tomorrow.
All right, thank you, Kenny. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hey, Governor. Hey, everybody. I'm wondering about striking the balance between opening up these West Virginia attractions and people from out of state who might want to come here. For example, whitewater rafting and ATV trails open tomorrow. Certainly those are attractions for people both from within West Virginia and from elsewhere. In a few weeks, there's a schedule for casinos to reopen, which would affect the populations in the Northern Panhandle and the Eastern Panhandle, and people from out of state may be enticed to come use those casinos. On the topic of fairs and festivals, the state fair attracts people from both within the state and out of state. So how do we strike that balance of trying to protect our population with things that may be attractive to people from elsewhere?
Well, Brad, I'd be lying to you, and I'm not about to do that to anyone, but I'd be lying to you if I didn't tell you that it was really, really difficult to do. I'm sure other states are faced with exactly the same dilemma, because we as West Virginia travel to other states all the time, and whether it be, going to Ohio to ball games or going to Myrtle Beach, so our other states are have to, deal with the balancing act of what to do. I think what we have got to do is realize just this as West Virginians, or some way, somehow, we have got to understand that we as West Virginia and we as a nation, we have to go forward. We have to reopen. And not only do our citizens want us to reopen, and I surely understand that our citizens at the same time are concerned, I'm concerned, but as we reopen, we have got to have in place the abilities to take care of an outbreak, the abilities from the standpoint of our hospitals, the abilities from the standpoint of testing, the abilities from the standpoint of us being able to run to the fire with a strike force and be able to put a fire out. Now, there's going to be fires. That's all there is to it. I mean, it's just as simple as that. As long as we have this disease and we've got to live with this disease, there's going to be fires. And in West Virginia, we are trying with all in us to be able to allow us to open back up, to entice things like what we just did with our state parks and everything, to entice more West Virginians to go and not entice a whole bunch of out-of-state people to come. Now, at the same time, what I'm really hopeful of is as we begin to open up, things like our casinos or whatever like that, that other states will be opening as well. And so the attraction to come to us will be minimal to the attraction for them to go to theirs. And so there's all kinds of different things that you're trying to weigh out and balance and everything, but the biggest driver is just this, and that's why we did this in the very beginning. You see, this is not just a hunch or a gut feeling. We're watching the numbers. You see, we have some real science, some real math to what we're doing. And even though, it doesn't look absolutely perfect because it's not. No, there's no playbook. Nobody's ever done this before. But we're watching the numbers. And as the numbers move, we'll move. And that's what we got to do. We have got to manage this situation. And as the numbers move, we move and everything. And if that means we've got to move and to slow, or to stop or to back up, that's what we'll do. But what first and foremost thing we'll do is we'll run to the fire and try to put the fires out, you know. But at the end of the day, it's a real balancing act. The easiest thing in the world, the easiest thing on the planet for me would be everybody stay at home, buckle up and lock your doors and stay there, and I'll call you on Labor Day in September. That'd be the easiest thing in the world to do. But we can't do that, West Virginia. And we can't do that as a nation. We'll slip into the awfulest times of all time. And so if we have to open back up, and we do, then we got to manage it. And that's what we're going to do. We're going to manage it as the very best we possibly can. Sure, it's argumentative of, you know, should this open or should this not open? Sure, it's argumentative of that somebody from out of state may come. You know, absolutely they'll come. We got to stay on top of it. We got to move north, West Virginia, and we got to keep going. And as we keep going and everything, we'll watch. You've got a backup of people that are watching this and absolutely won't rest until it's over. And so, West Virginia, you know, you've got a great insurance policy, but I tell you from the bottom of my heart, be concerned and be smart and do the right things. Please, please, please do the right things. And know that all we got to do is make it probably for another 3 to 6 months, and we ought to have a vaccine that will really be able to take care of us and really ensure that at least we'll have a drug that will keep us from a killer and maybe diminish it to a common cold. And so yeah, there's risk. There's real risk. And we got to manage it. We got to manage it because we got to live with it.
All right, thank you, Brad. Next, we'll go to Taylor Stuck with the Herald Dispatch.
Hey all, it's Taylor with the Herald Dispatch. To Dr. Marsh's remarks today about wearing face masks and how many people should be doing that, what do you think more can be done to encourage people to wear more masks or to get, I don't know, that seems like a really high number is really just kind of what I'm saying. And so what more can be done to encourage people to get to 80% of our population doing the right thing?
Well, Taylor, you know, we continue to try to educate, and I continue to try to tell people over and over and over, wear your mask. I mean, what in the world does it hurt to wear your mask? And absolutely, if you go out and you go into a store, you go into a public place, wear your mask. Absolutely protect yourself and protect others and wear a mask. Now, at the same time, you know, Taylor, here's the bottom line. You know, I hope to goodness we don't get to the point in time where we've got to mandate that you have to wear a mask. I hope we don't get to a point in time that we're going to have to shut down and everything else. But if we do, we will. We will. You see, I've said over and over to you, you know, I don't regret being in this position right now. It's tough, but I will do my job. That's all there is to it. And so the long and the short of it is, I would encourage people in every way to be smart, wear their mask when they go outside, and it'll be okay if we'll just use great common West Virginia sense.
All right, thank you, Taylor. Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. I was hoping maybe you could clarify the rules and regulations when it comes to weddings, not just for the vendors and the location holders, but for people who are planning. I wanted to make sure that I was clear on that and what people should plan for this summer.
Well, I'm gonna ask Brian Abraham to come back over here and talk to us about that and everything. The question is clarify the guidelines about weddings and things like that, and give some more clarification, I guess, to the 25 rule and whatever.
Okay, so what we've been seeing is a lot of places have been calling England, does the 25 public gathering apply to me? And all along those essential businesses that have been open, the public gathering has not really applied to them. So as more businesses are being relieved from the guidelines and, if you will, falling into the essential business category, our in-restaurant dining, our wedding chapels, those things that we've allowed, the question has come up, does the 25 number apply? And what we've said is, no, you have guidelines in place. So, for example, restaurants, if we have said indoor dining is limited to 50% of average occupancy, then that's going to be the number that controls and not the 25%. Our churches, we have never closed. We put out guidance on our churches and said, please try to socially distance by sitting every other pew, sitting with family units as you can, put procedures in place to be careful. So that didn't limit by 25. So again, we've had one-on-one people calling and asking questions. We've been answering and trying to clarify, but we felt it was necessary to go ahead and make that announcement because we had been getting more of the inquiries as we begin to open more businesses.
All right, thank you, Amanda. Next, we'll go to Steve Adams with Ogden Newspapers.
Yes, Steve Adams with Ogden Newspapers here. Yesterday, the unemployment numbers came out. I don't think they were much of a surprise to anyone. I know Scott Atkins predicted last week that they would more than double, and they did, north of 15%, which from what I saw was the highest number that the state has seen in unemployment rate since 1984. Can you talk a little bit about your thoughts on that number? And obviously, with businesses starting to reopen in phases, employees are being called back to work. Where do we see that number? Do we have any indicators of where we see unemployment going as far as next? Do you see this number that came out as the peak unemployment for this period? Thank you.
Stephen, that's a good question. And yeah, the numbers came out yesterday at 15.2%. I can tell you that's not going to be the peak. If you look at the trends, we're probably going to peak out at 20 to 21%, maybe as high as 22%. Obviously, as the economy opens up and more folks go back to work, that should level off. But I'm pretty confident that next month's numbers are probably going to be just north of 20%.
And Stephen, maybe I could just add this, but in our meeting with the revenue people yesterday evening, our collections were really a pleasant surprise. Our collections are mildly better than what we projected, not from the standpoint of what we projected in the beginning, but what we modified and projected from the standpoint of what we thought, we were going to have with this pandemic on our hands. And so, that was good. But Scott, I think is correct. As we get on from the standpoint of into June and we get the true May numbers, we're going to fall some more, I believe. And as far as the real statistic of total unemployment, but from the standpoint of dollars, what we have projected and budgeted and everything, the May numbers are coming in a little better than what we thought, and that's really good. And we're now projecting that May, from the standpoint of the numbers that we are budgeting, and those numbers are a lesser amount of dollars. We're budgeting about 75% of what we would have expected if we didn't have this pandemic. But budgeting at that 75% delta number, we're really probably going to come in a little better than that. Not much, but a little better. But that's good news. And so the net of the whole thing is, I think when we collect the May numbers, on unemployment, naturally we're going to dip even more, even greater than the 15% plus, situation we are at today. But that's not the numbers that I'm looking at. I'm looking at the revenue that's coming in and all the different taxes, whether it be sales tax or whatever like that. And I'm encouraged by the numbers that we got last night.
All right, thank you, Steve. Next, we'll go to Paul Mullen with WCBC Radio.
Good afternoon, Governor. Good afternoon, panel. I live in Western Maryland, right across the river. And when the announcement came out that Governor Justice was opening up the bars and restaurants in West Virginia, a lot of people in this area of the state that don't have that opportunity says, you know what I'm going to do this weekend? I'm going to head to West Virginia to go to a bar or go to a restaurant. That puts those restaurant and bar owners in an interesting position to where they're going to have to turn some people away, doesn't it?
Well, it could be. It could very well be, because, you know, if we get greater than that 50% capacity, well, we're not going to be able to take care of anybody, you know. But I really, you know, guys and gals, it's just as simple as this. You know, you could be dadgum if you do and dadgum if you don't. And as you go forward here and everything, I think what we have got to do is do all the proper things at the bars or restaurants or whatever like that we can. If they can possibly temperature test and everything, you know, absolutely we got to do all the social distancing, all from the standpoint of hopefully, you know, the people, especially the workers there, will be wearing masks and everything. All the different things that we have to do in order to be able to try to protect us and still move forward, we're trying to do that. And so we'll just continue to stay on top of it and watch the numbers as best we can, and I think we'll be okay.
All right, thanks, Paul. We have time for one more. We'll go to Phil Kabler with the Charleston Gazette-Mail.
Governor, today President Trump threatened to withhold federal funding from the states of Michigan and Nevada if they proceed with plans to expand absentee voting by mail. First off, do you believe this is a legitimate threat? And secondly, are you concerned that the president might threaten to withhold funding to West Virginia as we proceed with absentee voting by mail?
Phil, I don't want to speak for our president and everything, but I know there's surely some issues with Michigan. I don't know much with Nevada and everything. I am not a fan of the absentee balloting. I think there's too much possibilities for some levels of corruption with that, and I'm sure our president has expressed those concerns. I can't imagine that the president's going to withhold funding in any way to West Virginia. That's not going to happen. But I do really want to urge everyone to get ready to go to the polls and vote. And I think we'll be able to handle that, and I think we'll be able to handle it very safely and get you in and get you out of the polls. And I encourage you, if you cannot get to the polls and you are very concerned and don't want to come or whatever it may be, you know, or have health issues or whatever like that, you know, do the absentee balloting, because we want everybody to vote. That's for sure. And so that's about all I can add. I don't really know the situation between Nevada and Michigan, but I do know that, you know, from West Virginia's standpoint, we want to get you to the polls and vote.
All right, thank you, Phil. Governor, I'll turn it back to you.
Okay, I've just been handed a thing on our DMV reopening. I want to read this to you because I haven't looked at this, so I'll just read it to you. The West Virginia DMV announced that beginning May the 26th, they will begin taking appointments for services that can be done in person. This is to limit any waiting line inside the buildings for the safety of the staff and everyone there and the people that are coming in. The DMV is also extending the driver's license and vehicle registration expirations until August 1st. Almost all transactions can now be done online, and we encourage you to do that. If you need an appointment for the DMV service, you can now reserve a time at the website that's on the screen. And I want to thank Commissioner Frazier for all the work that he and his staff are doing, and tell him just please keep up the hard work. And the only last thing I would end with is just this, and And I want to make sure that I heard this correctly but if I could ask Dr. Marsh, a stat, did you not say, Dr. Marsh, that Japan's total death loss was 750 or 780 or whatever? Is that correct?
That's correct.
Okay, well, just think about this, West Virginia, and just use your really smarts that I know you use every single day. Japan, I think Dr. Marsh told us that Japan is 38% of the population of the U.S. In the U.S., a lot of times we push our liberties and we have the ability maybe to go without a mask, and so we just are not going to do it. And so we run out here and there, and before you know it, we get ourselves in trouble. In the nation of Japan, if they've lost 750 plus people, it may have been 783 or a number like that. In the United States, that country is 38% as big as us. And you watch them on TV, they've all got masks on when they're outside and everything, and they're all trying to look out after who? They're trying to, or whom? They're trying to look after themselves. And they know if they look after themselves, you have to manage one person. You have to manage you, West Virginia. That's all you got to do. And if you manage you and you manage you properly, then what happens is you don't affect somebody else. You don't get sick yourself. Your family stays in great shape and all that kind of stuff. Now, think again. Japan. Japan's got 126 million people. We've got about 330 in the United States. So we're 330 million or 126 million, and that's about what it is. Now, in just a matter of days, we will exceed 100,000 people dead in the United States. Every single day, every day we lose 1,400 people right now. In a half of a day, we are going to lose as many people as Japan has lost. I'm a real believer. You don't have to read it in a book and understand it. You can just look and then find somebody that's doing it right and copy them. So West Virginia, please, just wear your mask if you go outside and you're going to be in a crowd of people and whatever like that. Protect yourself and protect others. Do all the things that will make you absolutely just what you already are. The miracle. You are the miracle, West Virginia. That's all there is to it. You have absolutely existed within a rock's throw of 2/3 of the population of this country, and you have 69 deaths when everybody around you has 6 times, 10 times, 20 times, 50 times as many deaths as you. And that's just the people around you. That's not talking about in New York or wherever it may be, New Jersey. West Virginia, you are the miracle. The miracle because you're the smartest and you're the absolute most loving and most caring people. You're the absolute brightest in every way. Just keep being that. Just keep being that, West Virginia. Take heed to what Dr. Marsh said about Japan. It's right there in front of you. Take heed and we'll stay safe. And we'll get there. Thank you so much.